Yes. Hi,
Hi.
I'm Alex.
My name is Robert.
Robert, nice to meet you.
I had a quick question for
Sure.
you. So I'm here to get a refill from a albuterol, and you guys told me that the refill is too early, and I can't breathe without using my inhaler. Is there a reason why it's too early?
Okay, well, let me just get some information from you. How often are you using your inhaler on a weekly basis?
I say about 4 times a week.
Okay. Also, how often are you experiencing your asthma symptoms, such as chest tightness, shortness of breath, wheezing, or coughing?
It's about 3 times a week, but that's especially when I'm outside playing football or basketball.
Okay. Well, based on your symptoms and your frequency of your rescue inhaler use, we will typically classify you under not well controlled.
Oh, okay.
So we can go ahead and contact your doctor and let him know that your asthma symptoms are getting worse and your medications aren't controlling your condition as desired. And then perhaps he'll be able to prescribe some sort of maintenance medication, like inhaled corticosteroid, for example. Do you have any other questions about that?
I actually do have a question for you. So is there a way or a method where it could help monitor my symptoms to see if it's getting worse or hopefully even better?
Right. Well, what we typically recommend for our asthma patients is to use what we call a peak flow meter. I actually have one right here.
Okay.
So these are used not to diagnose your asthma, but merely to maintain or actually monitor how well your asthma symptoms are under control. So first what you're going to want to do is open it up and then fold this down like so. And then when you are not experiencing symptoms, you're going to want to record your personal best peak flow meter reading. And that's going to be done first. You stand up, set this red meter right here down to 0, and then breathe in deeply, and then exhale sharply and as forcefully as you can for about 1 to 2 seconds. That's going to shoot up this red meter to a certain number, and that's going to be called your peak flow best. And then on a regular basis after that, you're going to want to monitor your rating. And by doing that same process, set the red marker down to 0, and then do the same process. Stand up, exhale, and it's going to send the red marker up again, but it may be to a value less than your peak flow best, and that could indicate a worsening of your symptoms. However, when you compare that to your personal best, if it's 80% of your personal best, that's in the green zone. And if you're 50 to 80%, that's the yellow zone. And then below that, below 50%, that's the red zone. And when you're in the yellow zone, you're typically called not well controlled. And then when you're in the red zone, that's especially not well controlled, and you're going to want to contact a medical professional to get help immediately. Okay.
And just to make sure the green zone is if you're doing good, right?
Yes, the green zone means well under control.
Okay.
Okay, and so we also have these wild cards over here as part of the Script Your Future Medication Adherence Program. Would you like to learn more about that today?
I would love to.
Okay. So these are just wild cards. On one side, you have questions to ask your doctor and pharmacist. That just helps you be more aware of what you're taking and why you're taking it.
Okay.
And then on the inside, we have your medications. You just make a list here, why you take it, when you start it, when you need to get it refilled, how you take it, and when to take it.
Okay.
So you just go ahead and fill that one out for you when you have time.
Oh, I would love to. This is a great way to remind myself, when to take my medications.
And also on the back here, there's a pledge. If you just sign there, it's just a pledge that you will take your medications.
Okay, yeah,
So sign that when you
I would love to do this for, my teammates and family. So thank you.
All right, that's great.
Okay.
All right, Robert, you have a great day.
Thank you so much.